Imperial College's A&E waiting times. Clearly this is a matter of great public concern at the moment. So, Steve, I understand you've got a few slides that you'll talk us through by way of introduction, and then I'll open it to questions from the panel.
Absolutely, thank you, Chair. And I'd just certainly like to introduce Dr. William Oldfield, who's our Deputy Medical Director, and he's also a consultant respiratory physician with the Trust as well. So Bill can equally participate on any other clinical aspects of the questions that the committee might have. Thank you, Chair. I'll just briefly take you through the slides that you have, really, that sets our kind of current context in terms of our performance, and particularly on some of the actions that we had to put in place in previous months, and some of the further actions we're going to take to actually rectify the performance of the position. And then be very happy to take any questions that you may have about any aspects of this, and I know I'm sure there'll be a number. The first slide, slide 2, I think just very quickly puts some context about the waiting time standards, just in terms of terminology. I'm not planning to kind of dwell on that, but I know there had been some discussion at previous committee meetings about the nature of what Type 1, Type 2 and Type 3 activity going through an emergency department is, and how some of those waiting time standards track into how that is measured through the A&E. So that's just a little bit of backdrop in terms of the definitions. Slide 3 sets out the attendances by type going back from July through to the most recent week ending on Sunday just gone, so week ending the 18th of January. So the key sort of message from this set of activity data is, if you look at the total ICHT attends, the backdrop is actually we have not seen any significant fluctuation in terms of the total number of attendances during that period, and I think that's quite an important position to state. What we have seen is some changes. Some of those were planned in terms of the changes after the Hammersmith EU closure, in terms of the way that activity has then flowed subsequently to particularly the St Mary's site and Charing Cross site. And I draw your attention to the line that says St Mary's SMH total T1 attendances. So Type 1 attendances are those patients who are either attending or being brought through the consultant-led aspect of our emergency department service. And since around the September into October time, we have seen the attendance levels increase, and you can see that through those numbers across that period of time. That is in line in terms of the number of attendances with what we had planned post the Hammersmith EU closure. So we had seen a step increase of attendances to St Mary's, and that's very much, in line with what we had anticipated. The Charing Cross Type 1 attends, which is the column to the left of that, again is broadly static, but we have seen an increase more related to seasonal variation, particularly through the early part of November and into December, in terms of the number of attendance patients attending onto that site. What some of this data doesn't show is, particularly over the last number of months, the pattern of attendances that we have been experiencing. And I suppose what we are now having to relate as the new normal in terms of how we are managing the activity through our Charing Cross and St Mary's ED. So the three things I would just sort of draw out from that is that what we've seen increasingly is a different pattern of what we would call surge or volatility in terms of attendances. So within the overall attendance levels, we have seen the swings, particularly on the St Mary's site, but less so on the Charing Cross site, being anything up to 100 different from one day to another, so it can be. So a difference of 100 patients from one day to another attending and coming through, particularly on the St Mary's site, and that translating to a degree also in terms of our admission profile. So the fluctuations have been greater than previous. Secondly, as I said, the Type 1 attendances at St Mary's have gone up. Mainly that is in line with our planning, but also what we've also seen is the level of acuity, particularly to the St Mary's site, having gone up as well. So we have seen the level of what we call Category A, London Ambulance Service conveyancing, or R1 conveyancing has gone up to us. So there is a greater level of acuity of patients being conveyed into the St Mary's site. Now, I think that is our new normal, and that is what we're having to adjust to in terms of then also delivering the timeliness of care in terms of the 95% standard. If I just turn the page and very quickly just point you to the absolute performance, so you can see the first slide, slide 4, tracks our performance, that particularly from around the latter part of September, October, position at an aggregate level has been reducing. That particularly hit a low in around the middle part of December, and over the last number of weeks, across the Christmas period, New Year period, but particularly in the first 2 weeks as well of January, we've seen that starting to pick up in terms of some of the measures that we've put in place that I'll touch on as well. And likewise, you can see how that tracks in Type 1 performance on slide 5. So again, we've seen that particularly hit a low point mid-December and start to track upwards in the last number of weeks. If I quickly turn to slide 6, so the winter resilience planning, so we had done a significant number of things in terms of planning for the change of state around the Hammersmith EU closure, but also the planning for the winter period, where that seasonal variation does see more people attending on the emergency pathway. So important to note that we had a capacity plan that did open more capacity on St Mary's and the Charing Cross site, and that was delivered during that sort of period. We have opened specific facilities up in terms of the cancer assessment unit and the older people's rapid assessment service, moving from 5 days a week to 7 days a week over this period as well. In spite of those measures, clearly we are not doing enough in terms of supporting the ED performance and ultimately the sort of timely flow of patients and their treatment through the emergency department, and that's something that is a significant concern to us. So if you look at slide 7, these are the additional actions that we have been taking over the last number of weeks and will continue to take through the next quarter, so as we can actually get back to a position where we are delivering that standard and delivering it consistently. So from the middle part of December and through to the early part of this month, we've now put an additional 6 emergency department consultants in place, particularly focusing on the St Mary's site, and that has extended the amount of senior decision taker hours that we've got actually within the department. In addition to that, we're recruiting 7 further, I think, Bill, 7 further acute medical physicians to work on the emergency pathway within acute medicine, again to support some of the downstream senior decision taking support that we need, particularly again on the St Mary's site. We've opened up 12 more beds on the 5th of January at St Mary's, above and beyond what we had planned to for the winter period. And we're also going to be relocating our urgent care centre that's embedded right in the middle of the St Mary's ED to a new facility on that site, and that releases more space within the majors part of our emergency department, so as we can more rapidly assess patients either as they are conveyed from the ambulance service or self-presenting within that department. We're opening up further a number of beds on the Charing Cross site, and we're doing that within the next 2 weeks. We've been actively working and proactively working with our commissioners and with social service colleagues about how we can more rapidly move patients into another location once their clinical care within the hospital has been completed. So as actually we're able to free up more capacity and get people into their ongoing care outside of the trust. And finally, slide 8, I think it's the broader picture around the NHS review of A&E services in North West London. So I think it's really important that we do collectively, as the NHS in North West London, understand and continue to analyse our data around the current performance within the sector and our part to play within that. And we're very much engaging with the review that NHS England, the Trust Development Authority and Monitor commissioned for North West London. We understand that that will be in the public domain at some point, and we've certainly contributed to that over the last 6 weeks. So I think, in summary, Chair, I think we recognise absolutely we're not where we need to be. We've got an absolute focus around improving around that, and we're deploying more resources as we speak to see improvement across the course of this quarter. I'm very happy to take questions.